Dr. Bell, thanks for joining us today. Our topic is prostate health, and our first question is, what is prostatitis and what are the symptoms?
Sure. Well, thanks for asking me. There are three main types of prostatitis. There's acute bacterial prostatitis, chronic bacterial prostatitis, and then chronic non-bacterial prostatitis. Acute prostatitis usually presents as an acute illness with fever and pain, usually at the base of the scrotum, oftentimes with painful urination and blood in the urine. It's really a dramatic, acute, severe illness. Acute bacterial prostatitis presents more gradually over a period of time, usually with painful urination, oftentimes with pain at the base of the scrotum, frequency of urination, really the same types of symptoms that acute prostatitis has, but a more gradual onset. The most common type of prostatitis is chronic non-bacterial prostatitis. It's also known as chronic pelvic pain syndrome, and that's a much more gradual illness or problem. Oftentimes people have, or men have, decreased force of urinary stream, dribbling or hesitancy while trying to urinate, and once again oftentimes have chronic pain, oftentimes in the lower abdominal area or between the scrotum and the rectum.
Why can prostatitis be difficult to diagnose and treat?
Well, the most common type of prostatitis is chronic non-bacterial prostatitis that I just talked about. This is not an infectious illness, and the symptoms are oftentimes the same as patients that have benign prostatic hypertrophy that we'll probably discuss a little bit later. So once again, the most common types of symptoms are decreased urinary stream, hesitancy or decreased force of urination, and chronic pain in the pelvic area. And these are the same symptoms that men have when they have prostatic hypertrophy, or even sometimes the early stages of prostate cancer.
What is benign prostatic hyperplasia, or BPH, and how common is it?
It's very common. Benign prostatic hyperplasia, or BPH, is non-cancerous growth of the prostate that occurs throughout adult life. Men oftentimes in younger ages start with a prostate the size of a walnut, and then throughout life the prostate grows steadily, oftentimes to the size of, say, a lemon or a lime by the time they reach adult ages. By the time they reach advanced age, say 70 or 80. Most men, by the time you get to 70 or 80, have at least some symptoms of benign prostatic hyperplasia, or BPH. And the symptoms are very similar to chronic prostatitis. Once again, the most common symptoms would be decreased force of urinary stream, dribbling or incomplete emptying of the bladder, and sometimes chronic pain in the pelvic area.
How do you treat BPH?
The most common treatment is watchful waiting. Many men, or perhaps most men who have BPH, have mild symptoms that aren't too bothersome, and in those individuals the most effective treatment is usually non-medical treatment, and that can involve reduction in caffeine, alteration in fluid intake, usually less fluid intake in the evening. If the symptoms get worse over time, and oftentimes they do, become more severe or more bothersome, there are several ways to treat BPH. There are several classes of medications, several medications in each class that can be effective, and if medications are ineffective, there are a number of different surgical procedures that can relieve the symptoms of BPH. That's usually the last step.
Why does the prostate gland in men seem prone to cancer? How common is it?
Prostate cancer is the most common type of cancer in men. At least half of men, probably more by the time you reach 80 years old, have at least some cancer cells in their prostate. But the important thing is that in most men, prostate cancer will never cause symptoms or never affect overall health. In some men it does.
Are there early warning signs for prostate cancer?
Yes. The early warning signs, though, are similar to the symptoms men have with prostate hypertrophy, or so-called BPH. Once again, diminished forcefulness of urinary stream, incomplete bladder emptying, and sometimes frequent urination at night are the signs of prostate cancer. But the thing men need to be aware of is oftentimes by the time symptoms show from prostate cancer, the prostate cancer has already progressed, perhaps involves structures outside the prostate. So that's why it's important to at least consider screening for prostate cancer.
How is prostate cancer treated?
Well, I think before we talk about treatment, it's important to talk about screening for prostate cancer. Okay. The two types of screening tests that are available are the so-called PSA blood test that I think everybody's or most men are familiar with, and the digital rectal exam. Prostate cancer can be identified early through these tests, but scientific studies have yet to show conclusively that screening for prostate cancer saves lives. So men should certainly consider whether they need to get prostate cancer screening. And beginning at the age of 50 in men at normal risk for prostate cancer, they should discuss this with their physicians. Some groups of men are at increased risk for prostate cancer. The largest of those groups are African American men or men with a first-degree relative, that is a brother or a father with prostate cancer. They're at increased risk for prostate cancer, and they should have that discussion with their physician beginning at age 45. Now, as far as treatment of prostate cancer, there's a whole range of treatment, and it's dependent upon a number of factors. It's dependent upon how advanced the stage of the prostate cancer is when it's discovered, that is, whether it's spread beyond the prostate itself. It's dependent upon the rate of growth of the prostate cancer. It's dependent upon the overall health of the man. It's, of course, dependent upon the preferences of the patient. Treatments in some men is just watchful waiting, that is carefully following the prostate cancer and making sure it's not growing or adversely affecting health. In some men, it's hormonal therapy, which reduces the rate of prostate cancer spread. In other men, it's the most appropriate treatment is more aggressive treatment, and that can be either radiation treatment or surgical removal of the prostate.
Are there proactive steps you can take to have a healthier prostate?
Yes, there are proactive steps. Regarding prostate cancer, the most important thing is to consider screening for prostate cancer with the PSA blood test and the digital rectal exam. Once again, in usual risk men, men should have that discussion with their physicians at age 50 or shortly thereafter. In men at higher risk, they should have that discussion with their physicians at age 45 or slightly thereafter. And once again, the higher risk men are African American men or men with a first-degree relative with prostate cancer. Other things you can do to keep your prostate healthy are just general health measures such as keeping a normal healthy weight and eating a healthy diet, foods rich in whole wheats, whole grains, vegetables, fruits. All these types of diet measures have been shown to reduce the overall risk for cancer. There are no specific vitamin treatments that are proven or dietary supplement treatments that have been proven to reduce the risk of prostate cancer or necessarily good for overall prostate health. There is one antioxidant vitamin like substance, lycopene, that may reduce the risk for overall prostate cancer, although the science is not certain. But it's easy to get extra amount of this. You find it in tomato or tomato-based products and grapefruit. So if you're going to supplement your diet with one type of food, then tomato or tomato-based products might be something to use.
Well, I think you covered nutrition with respect to keeping a prostate healthy. What about exercise?
I think just a generally healthy lifestyle that reduces overall risk for cancer is a good idea, and weight maintenance and regular exercise are good for overall reduction of cancer risk. And since prostate cancer is the most common type of prostate cancer that men get, then that's certainly true for prostate disease and specifically prostate cancer.
Very well. Doctor, thanks for your time.
You're welcome.